So what role will public health units play in deciding when their local communities can reopen their schools? Matt Ingram is following that angle for us and joins us with more. Matt?
Phil, Ontario's Chief Medical Officer of Health, Dr. David Williams, says he wants local public health medical officers to be fully consulted and in agreement with the decision before kids head back to class. In an afternoon briefing, Dr. Williams said his team has been working with medical officers beginning in areas with lower cases and asking them if they agree with the reopening timeline and if each public health unit is capable of aggressive case surveillance, and if so, assessing if they could keep up with an increase in demand for testing if that became needed. He says medical officers are all telling him the same thing. They want kids back in school, and Williams says both the province and the public health unit have a role in making it happen.
And they want their children back in school. So we're trying to make sure that we're connecting on that, and that when we're all ready to go, with our numbers coming down very nicely, that I'm hoping that by next week, we could, the week of the 8th of February, to have our schools open across the province. So that's the goal we're striving for, but I want to make sure that's done in full consultation with medical officers so that they're agreeing that, yes, we're ready for it, we can handle that.
Weekly incidents.
At today's City of Hamilton COVID media briefing, the city's medical officer of health, Dr. Elizabeth Richardson, was asked to explain how public health is engaging with the province on this decision. Dr. Richardson says Dr. Williams has been discussing the return to school with local medical officers since December, seeking advice and opinions, and says public health will work with school boards directly to make sure they are ready.
My anticipation is we'll continue to have that dialogue with the province around where we go from here. And at the same time, we'll be working with our school boards very closely to talk about what they need. We do know, I think it's really important to continue to stress that kids do best when they're back in school. And we know that schools do need to reopen.
Dr. Richardson says there's no specific threshold for her for when schools should reopen, saying simply that once public health is satisfied they can move forward, they will do it. But what exactly that means in terms of conditions wasn't exactly clear.